8 p.m. Roll call, please.
Elizabeth Stevens.
Excuse.
Roland Larishaw.
Here.
David Williams.
Here.
Anthony Cristalli.
Here.
Nicole Duffy.
She's on tele.
Available.
She's
She's on the
available.
phone.
Can we hear her?
Yes. Say it again, Nicole.
Here and you heard her okay?
Okay, I would suggest if it becomes hard of hearing, we have Anna here, and she can actually man the phone if it becomes necessary and convey Nicole's thoughts.
Sure.
Okay. Agenda item 3 is listed as Citizens Forum, but due to the governor's declaration of suspending certain provisions of the open meeting law and social distancing, we have no citizens here tonight or this afternoon, so we will move to agenda number 4, which is the discussion of actions of the Director of Public Health in implementing a Board of Health directive regarding town employees' exclusion following domestic flight travel. Mr. Director.
If I may, certain regulations exist. This board acts in unity. This board cannot act individually. By appointing an agent, Chapter 111, Section 30, allows that boards of health may appoint agents or directors of public health to act for them in cases of emergency or if they cannot conveniently assemble. Any such agent or director shall have all the authority which the board appointed him had. But he shall, in each case, within 2 days, report his actions to the board for its approval. So I bring the board together as a unit to explain what I did the other day. I reached out to board members individually and had discussions with them, and based on those discussions, I made a decision to quarantine town employees who have gone through domestic flights, gone through airports, to quarantine them the 5 days. The logic behind that 5 days was that though the word we get on the coronavirus is that symptoms will show themselves in 2 to 14 days, it usually occurs within 5 days. So I allowed the 5 days, made that decision. I additionally made a decision based on a healthcare personnel with potential exposure. This was a memorandum that came after I had discussions with the board or with the individual members. And that policy from the Department of Public Health states that a health worker who is exposed to a coronavirus patient may return to work immediately under specific guidelines. Basically, the facility has to have tried to exhaust all of their personnel before they allow them to come back. There's 3 or 4 things that are required. Specifically, all options to improve staffing detailed in your facility or organization's emergency management plan have been exhausted. The Occupational Health Services Program has been consulted. The healthcare facility has stopped all non-essential elective invasive procedures, and the healthcare facility has postponed any non-essential outpatient appointments. Again, remember the document is directed to healthcare. I took the logic of the healthcare, saying if they can return to work in a highly susceptible environment, then as long as I adhere to the requirements of them coming back to work, why could not the layman come to work who's not going to be exposing as many people or threatening our health force? So I further allowed, beyond the 5 days, if they wanted to come back to work earlier, they could, and these are the conditions that a healthcare person can be at work. So I said, okay, if a healthcare can be at work under these conditions, let's lay them out. So an employee can come back to work, provided they ensure the healthcare provider report the temperature and absence. So ensure the employee report their temperature and absence of symptoms prior to coming to work each day. So if they want to show up in the morning and say, I have a 98 or a 99 temperature, below 100, and they want to claim that they have no symptoms. The second one is ensure that the person dons a face mask for the entire time that they are at work for the 14 days after the exposure event. So if they want to wear the face mask for the 14 days, again, our quarantine was 5 days, so I would defer to the 5 days. Direct that if the employee develops even mild symptoms consistent with COVID-19, they must cease and go home, suffer the quarantine. And prohibit the worker with even mild symptoms consistent with COVID-19 from working while they are symptomatic. So I added that to my decision and I put that out. We have some kickback from that, but what I brought the board together today was to discuss my actions, determine if the board is in support of those actions or would like to vary those actions, and I am not insulted either way. I am one individual. This board is made up of the Board of Health of the town of Southbridge and gets the decision. So I am not insulted either way. And I would also like to speak to specific cases. We have 2 DPW workers who may be critical to the response of the town. If we go into any kind of government lockdown, or if we go into any further restrictions, the 2 DPW workers could be critical to ensuring the roads are proper, and then basically they could be critical to the response. We have a fire chief. We have a fire chief who is included in this. The fire chief is also the emergency management director, and he will become critical in any type of response. He obviously is critical even while he's out. So I want the board to think about those employees before they agree or disagree with me. I also have 2 EMTs who I had specific concerns about bringing the corona into the MRC group and therefore possibly devastating the group. However, they might be critical to making sure the things stay staffed enough to keep the group alive, to keep the group active. So I'm putting it before the board whether they think my actions were appropriate. I believe they were appropriate at the time, but as I sit here and talk about the specific duties of these people, it may be worth revisiting all of them or any individual ones.
So when we spoke,
Yep.
you laid out some information saying that there seems to be some discrepancies between the virus showing 2 to 5 days, it's 14 days. And when I erred on the judgment with these individuals, I think we all can agree that the community's health is foremost. However, when you have people in these critical positions, you need to look at all the data. And I believe that you took the correct actions as the information stood at that time. And I get that new information keeps on coming in on an hourly basis. So we need to be able to react and adjust with this new information. But as I said, Andy, when you had said these symptoms present themselves to 2 to 5 days, that was sufficient enough for me to say, let's quarantine for the 5 days and to see if the symptoms reveal themselves. So I can appreciate the actions you took, and I support them.
David?
Yeah, but with me, it's like
Okay.
the better safe than sorry, and just based on because we keep learning more and more, and again, people aren't textbook. You know what I mean? You know what I mean? It's just, you know, what's the norm here might not be the norm somewhere else, and that's why I originally had said the 14 days. You know, I can understand completely if people, you know, want to go with the 5 days. I understand that completely.
Okay, so basically Nicole was saying at first she supported the 14 days, but as new information comes out, she also understands why you took those actions and she now supports them. But we realize that this information, we get more information as we go along and better understand this virus.
David?
Right, so the board is generally saying, the majority is saying there's 5 days at this point, is that right?
So far, Nicole, yes. So
Let me clarify
one
thing,
second,
though.
Nicole.
Hold on. Nicole said something, and there is a audience out there that has a right to know what's said, so could you kind
Yes.
of Reader's Digest version that?
Can you repeat that, Nicole?
I was just checking to see if the board is generally supporting the 5 days.
So Nicole is just saying, what is the census of the board right now supporting the 5 days? So we'll keep you, so sit
Can
tight,
I ask that we
Nicole.
bring Anna up to sit on the end so that she can interpret for Nicole?
Sure,
That way you're not speaking
absolutely.
for two people.
Correct me if I'm wrong, Andy. Your original one was quarantined for 5 days,
The original one was quarantined for 14 days.
for 14 days. The way I originally read your memorandum, did you not change that at the end to reflect this new information that was put out?
The
That-
memorandum I put out included this new information,
So-
included the information on the healthcare workers.
Please
yes.
correct me if I'm wrong for the board. Did that not change that if the individual has no symptoms, as this guidance, and by the way, the guidance is from the Commonwealth of Mass, the Public of Public Health, and it goes to not only healthcare facilities but emergency medical services, that if the person wants to come back to work day one, no symptoms. Because yes, 4 to 5 days if symptoms appear at all. Some people never get symptoms. They will follow those provisions that you outlined to come back to work. So does that not erase the quarantine for 5 days? Because we've received this new information?
The options are as I put it forth,
Okay.
was that they sit out the 5 days, or if they choose to come back, they can report their temperature in the morning before work and wear the mask for the full day. So
For the term,
if
for
they chose to wear the
time
mask.
period of the 14 days after?
No, because the quarantine we put on was 5 days. If they choose to wear the mask, I would think that we would stick with the 5 days because we recognize that as acceptable. There is no positive knowledge that they were exposed to any, this is all on assumed knowledge, and that's
Erred on the side of safety. Yes.
correct.
Okay. David?
So, I agree with Tony that I think the correct action at the time. But more that I'm reading up about this, I kind of disagree that just traveling is considered highly exposed. According to even the Department of Public Health, Mass Department of Public Health, they only consider that communities, Seattle, King County, Washington, Westchester, New York, and Salina County, California, as in those, high level 3 travel areas. So I don't think just traveling by plane automatically puts healthcare workers in a category of highly exposed, okay, highly susceptible. I think if somebody traveling by car to Westchester County is a bigger risk than traveling by flight to Ohio. So I think it has more to do with where they're going than how they get there. I'm more inclined to go along with the acting chair that they should all have their temperature reported, that they should all be absence of symptoms, and like the Department of Public Health, it's like fever or mild or moderate respiratory illness. That's their lowest category, their category 8. Yes, if they have a fever or a mild or a moderate respiratory illness, absolutely that would preclude them from, we can say they have to have a mask. But I'm not currently in favor of just traveling by plane to be a quarantine.
So are you agree? All right, so you're not agreeing with Andy's 5-day quarantine?
I'm agreeing that if they show symptoms,
Okay, yes.
yeah, that absolutely,
And then
and that
by the-
all employees.
By the DPH situation is that if you show symptoms, you go home.
Right, either reported symptoms or
Correct.
that. But I just don't think just traveling by flight is is enough.
One question that we did not get, did any of these people travel to any of the hotspots?
I'm not aware of where they traveled for their vacations. I know 3 of them went to Florida. I don't know where the other 2 went.
So for that concern, I think the agreement or the consensus of the board for what you're talking about, we know 3 of them did not travel to what today is a hotspot. We should research where the other 2 traveled. If they didn't go to one of the hotspots like New York City, Washington State, California, they should follow what Dave was talking about. If they did, that would be an added precaution.
Well, I'm just saying to follow the mass.
The guidelines.
You know,
Yes.
Guidelines and not to increase the guidelines
So-
at this point.
So
I
let me
would
just
prop-
understand this. So if they did not fly into one of the hot spots and they show no symptoms, they can report back to work the following day? Is that what?
I would propose there be 2 actions here. Because I took an action yesterday, I think there should be a vote either in support or not in support of that action. And thereafter, if this board wants to change that action based on current information, a totally separate action.
Okay,
And again, not insulted either way, I took my best guess.
okay.
And I agree with that at the time.
So at this time, we should make a motion on Andy's
Is everybody,
actions. All right.
is
so-
everyone clear on the action, the verbiage that Andy took yesterday, including Nicole?
Well, I think we should make sure we all are.
Okay, Andy, can you just reiterate what the verbiage of your actions yesterday so that we're all clear?
My actions yesterday resulted in a 5-day quarantine. I'm sorry, what you sorry?
That was self-quarantine, correct?
Correct. Actually, it was a omission from work. It wasn't a quarantine.
If I can what? I'm sorry, Nicole. Okay. Okay, so she wants me to recap, so I'm going to try and do that, and if there's any, if I get it wrong, tell me. So Dave Williams felt that in accordance to DPH, the guidelines would not support a restriction based simply on domestic travel. So he was not supporting Andy's decision based on DPH's recommendations or lack of recommendations in that regard. Okay? So then Andy suggested that there be 2 actions taken by the board. The first one being whether or not the board supports his action that has already been taken, and the second one being action to be taken at this point. Is that correct, Andy?
Yes, that first action would be to make a determination if my response was appropriate. Second one is there any adjustments to that response that the board would want to make?
Did you get that, Nicole? So the first is that, does the board support the actions Andy took? And the second would be, would there be any adjustments to that action?
I have to say, I don't like the vote. Slows things down.
She's got to be brief.
Yes, I think that probably, I think what Nicole is saying, and you can correct me if I'm wrong, she wants clarification on what the action
That's
is.
what
That's
Andy's about to do right now is to state what those original actions, the verbiage of that original actions with the numbers so that we can get that original action crystal clear.
And then we can move to a motion.
Andy's going to state
Correct.
what the original action was to have that completely clear for the board and for the record, I would imagine, right?
Yes.
So-
Is she ready?
You ready?
Absolutely.
Okay.
So the action I took yesterday was that any town employee who who took domestic flight
Sounds good.
for vacation or anywhere, who got off a domestic flight, would be quarantined for 5 days based on the reasonable assumption of that symptoms would show up by that time. Not quarantined, they would be excluded from work. Secondarily to that, if they chose to come to work, they could come to work immediately if they were willing to report their temperature every day for 5 days, don a face mask for the entire period of the day, for the entire work shift, and if they develop any symptoms, even mild symptoms related to COVID-19, that they would be removed from the work at that time.
Yes, okay, thank you.
Everybody clear on that?
Yeah.
Yes.
So, one of the reasons for the meeting today is I'll entertain a motion to accept Andy's action as written.
I will make a motion to accept Andy's actions with the information he had at the time of the 5-day quarantine.
I'll second.
I'm sorry. Could you repeat, Tony?
Yeah, I said I will make a motion to accept Andy's actions with the information that he had the other day to quarantine for 5 days after a domestic flight.
She wants me to give him the phone. Do you want?
No, we can't.
Yeah.
It's got to be,
Yeah.
we can't.
Sorry.
Just go.
The motion from Tony and seconded by Dave was that with the information I had at the time, the action was appropriate.
Perfect.
So we have a motion and a second.
Ms. Nicole weighs in that she thinks the action was appropriate, but
Okay.
we have a
Any
first
other
and a second.
discussion
So,
on that motion?
no.
We'll take a vote. All in favor?
Hold on, the chair is asking for additional comments? No additional comments.
Okay. All in favor? What's
Those
your
in
vote?
favor? Ms.
Yes.
Nicole supports.
Okay. It's affirmative of everyone present.
I'd like to make a second motion
Go ahead, Dave.
that the action be amended to follow the Mass DEP healthcare personnel and potential exposure to patients with COVID-19 guidance letter sent out on March 19th, 2020, that we accept these actions.
Dave Williams makes a motion to...
Correct me if I'm wrong for the audience.
It's in.
The only amendment or difference
need a
between
motion
the vote we just took
we
and what Dave proposed
respond
is that
In accordance with the letter.
if
for
one of our
healthcare
employees has been exposed to someone
providers, going to make argument that
who is suspected to be carrying the virus, they will follow those guidelines.
the only other action would be... to
Correct, David?
Correct, with an addition that we do not consider just air travel to be considered highly
Yeah.
susceptible,
Dave is making a motion that...
highly susceptible,
travel
that
not be
only
considered
traveling,
potential.
but traveling to the aforementioned communities or any community that the
Dave's making...
public health.
And this will also address, if I may, EMS people going to respond to a citizen that is having signs and symptoms of an illness. And I say an illness because until they are tested for COVID-19, it could be the flu, it could be seasonal cold or allergies, but the precautions must be taken following these
Can we hold
guidelines.
on a minute? Is there a motion on the table? And is it seconded?
There was a motion.
So what is the motion?
The motion is to follow the
Follow the guidance.
healthcare personnel and potential exposure to patients with COVID-19 guidance dated March 19, 2020. And the only thing we were discussing was the clarification that we do not consider just domestic air travel to be to be a highly, to be a person.
To be an exposure.
Person being
Yeah,
highly
right.
exposed.
So Dave's motion is that we follow the guidance of the document on the 19th, the emergency health care workers. I talked to you about that yesterday, but that we not consider domestic flight to be an exposure. Therefore, if this is seconded, it's not seconded yet, so no comments yet, but if it's seconded, then that means that somebody getting off a domestic flight is not subject to any restrictions. That's the motion. Is there a second on the motion?
I will second that.
Tony makes a second. Nicole has a comment, if I may have a second.
Go ahead, comments. Nicole?
Consider domestic flight.
Nic- Okay, Nicole's comment is that the close proximity of the airplane, the close proximity of the airport increases the risk of exposure, and she's not willing to take a chance on that. Accurate. Yep. Yep. We have food establishments closed. We have 3 cases in town. She just doesn't think we can risk that. Accurate?
Okay.
Yeah, it's, who knows what the right answer is.
So,
Further discussion?
so what is her intentions, because we just voted?
We didn't vote. There's a motion and a
vote,
second.
okay.
It's just,
There's a motion and a second. It's open to discussion right now for whoever wants to discuss.
And so her thing is that she's not in support of it.
She is not in support of that motion. Way too much of a risk.
Way too much.
Risk.
Okay.
Yep.
Like I said, was it in a matter of less than 2 weeks? We went from no cases to 3 cases. It's too much of a risk. I mean, it's clearly passed from travel from being in proximity.
She's saying that we've got restaurants closed, we've got a state threatening further action, the country's threatening further action. We've got 3 cases in town, and all 3 cases, the assumption is they came from close proximity. These travelers are in close proximity, so.
Separate issue, but I think that's a separate issue. She's got to move.
But we already addressed that in the previous motion of the stay home
Yep.
for those that traveled. This, I think, what Dave is talking about, if I may, this memorandum from DPH, if you want to
Interpreting.
strike
Memorandum from DPH.
the airport travel situation, because that might be the hiccup, because this memorandum, potential exposure to patients with
Correct.
COVID-19. You're absolutely right, in my opinion, that going through an airport may or may not. If someone was proved to be sick on the plane,
Different animal.
people have to be notified. That is a whole different situation.
I'll amend my motion and make another motion separate to that to address that issue. Okay? So I'll
And
amend my motion.
and that follows this thing with
I agree.
anybody with, and if you work with somebody that's exposed.
So just amending in my motion to follow the guidelines by the Mass DPH.
The general conversation on this side is that airline travel not be considered a potential exposure. There's nobody in the airport that's been identified. There's nobody on the plane that's been identified. So the general discussion right now is that airline travel in and of itself would not be an exposure, and therefore would be an exempt from our exclusion.
Can you ask her to keep her comments very limited, so because
You gotta stay brief. You gotta stay brief. Nicole's argument is that you cannot possibly
Yeah,
Andy,
but that's not the
Assume
argument.
that
that's
many
not
are
the
not.
argument. If you could let her know, the amendment, I mean, this motion that Dave is talking about that he's amended has nothing to do with travel. We have adjusted to those 5 town employees already to travel. This one from DPH, that if one of our town employees is in contact with someone that has the COVID-19, then they follow these guidelines set forth by Department of Public Health. Regardless of where they came from, whatever, this is like the Ryan White Act for any other contagious disease for people that are exposed to anything. The reporting has to continue, and then the guidelines of what we do after, what is done to get them back to work, is all addressed in these guidelines. That's what Dave's talking about. He amended it to take travel out because the subject is exposure to patients with COVID-19.
Okay, but however, the original action was based on the assumption that air travel in and of itself was potential exposure. Are we removing that from the table?
That was the last vote.
He amended
He
his
amended it to
motion.
remove air
Can I-
travel and just stay with that.
Go ahead.
So our first motion was a motion to support Andy's action at the
Correct.
time. Okay. With our next motion that's on the table is to follow the mask guidelines for COVID-19. The confusion is I added in the little caveat that we don't believe that just domestic flight automatically puts somebody at interacting with an exposure to COVID-19, which I'll make another motion to say travel to those communities, but that will be at a later time. So right now, it's just following the mass DPH guidelines about people who are exposed to known exposures, what the policy and what their actions are supposed to be, as Roland laid out.
So, again, you are removing
Yes.
airline travel
Yes.
as a potential
Yes.
exposure. Airline travel in and of itself, you're removing it as a potential exposure because we have no evidence that anybody there has it.
Well, it's not part of it's not even part of the question.
Ms.
We're
Nichols-
not making an assumption
Okay, so
either way.
Ms.
We're
Nicole-
not taking it off and we're not putting,
Ms. Nicole believes that it is still a potential exposure.
it's not even on
and
the
that's
table.
her stance.
It's
Okay.
not even on the table.
It has to be on the table because the whole reason for this is these people did airline travel and we said you must be quarantined. So what's our action from here forward on people with airline travel? This whole thing was based on they had
So,
airline travel and we thought airline travel was a exposure.
so it's,
Wait a minute. The situation with airline travel and our 5 employees was the last motion. We supported your motion for having them self-quarantine at home, not to come to work, for 5 days.
Yes.
That addressed our 5 employees who did domestic travel. Now, that is done, voted on,
The first vote was to support my actions at the
Correct.
time.
correct.
We are now moving on to, do those actions need to be amended? Basically, we still got employees out. Do we let them back based on what we know now?
Yes.
Or do we keep, so the only question is, does my action get amended at this point in time? And I understand there is a motion on the table by Dave that suggests we not consider airline travel as a potential exposure.
He struck that from his motion. I believe, and please correct me if I'm wrong, Dave.
Why don't
Your
we-
motion as amendment is if at any time, anybody, any of our town employees by this memo is proven to be potentially exposed to a patient, a person that has COVID-19, then, and only then, does this document be followed on when you're going to be out of work, when you can come back to work, so on and so forth. That is only if now, at such time information is received that anybody was exposed to a known carrier of COVID-19.
So I think I can clear
Correct.
things, up if we remove that motion that I just made off the table do a secondary motion that I have to deal with the travel directly, deals with both the airline travel issue and all that. So if the chair will accept my removing and making another motion, I'd like to do that.
Madam Secretary, did we get a second on his motion to start with? I don't believe we did. So therefore, there was no motion. There was discussion on the motion. So
the motion never
if
gets
you want to
seconded,
erase
so
it,
now there is-
retract
There is no
So
motion.
can I make
Dave is
another
proposing a motion.
your original one
we'll do
and make a new motion for consideration?
Yeah, I would like to make a new motion for consideration.
Go ahead.
So I would like to make a motion that we follow we follow Andy's Mr. Pelletier's guidelines for any travel to the currently identified communities that are considered high risk, currently being King County, Washington, Westchester County, New York, and Solano County, California. That any travel to those communities, regardless of whether they went by car or plane or horseback, we'll consider that they would follow the guidelines that Mr. Pelletier set forward, a 5-day quarantine and so on and so forth, okay? But only to those current.
Only to those countries, so he's not saying to any
Okay.
other. Any domestic travel is
Do we-
okay except those.
Do we have a second on
We gotta wait for a second.
David's motion?
So just so I'm clear, travel to high risk regardless to how, sorry, travel to the high-risk communities regardless to how they get there. We follow Dave, Andy's, all right. I will second that.
Okay, we have a motion and a
Motion
second.
is seconded by
Entertain
Tony.
discussion.
Discussion.
Does Ms.
Nicole.
Nicole have anything briefly?
Specifically, Dave's motion is any travel to the county in Washington that is King County, Washington, Westchester County, New York, and Solano County, California, which are 3 hotbeds of activity. Any travel, if you walk there, you come back, you get excluded from work, according to my policy. Any other airline travel is excluded from the policy. Airline travel in and of itself is not considered an exposure. Okay, Nicola's expression that any travel should be considered and that Boston is an international airport and travel through Boston is especially scary. Accurate?
So she is voting no.
She is not voting until you call a vote, but she's given her
That's her
opinion.
opinion. Okay, do we have any other discussion on Mr. Williams?
I just think this could change tomorrow.
It could change this
Tony
afternoon.
expresses the liquidity of this
absolutely.
and that it could change tomorrow.
So at this point in time, with the information that we have, do we have any other discussion? Seeing no discussion, are you ready for a vote? To amend Andy's, which would be Agenda 4, which deals with flight travel. All those in favor of David's motion?
Calling for a vote on the motion, which your vote is yes or no? Ms. Nicole is voting no.
Okay. So it is 3 in favor of the action,
So
1
the action is 3 to 1.
opposed.
All right?
So that takes care of agenda number 4.
So I'll go back to the motion I had previously to, that we follow the healthcare personnel and potential exposure to patients COVID-19 guidance set forth by Department of Public Health.
Okay, so that,
Third motion.
for the audience, the Department of Public Health put out a memorandum, and that was put out March 19th. And the difference between this vote and what possibly could be confusing to somebody listening at home, it's very pertinent, and addresses any of our personnel that are exposed to anyone with the known COVID-19 virus. That will protect our EMS system, firefighters, police, everybody else in town. And this will also be retroactive to those that traveled if at such time information is arised from somebody that they were sitting next to is positive on a test because they were ill. It addresses the time that when we have a known exposure to someone that has the virus and the actual procedures to take. And this document also helps all our departments in their COOP plan on when people go out and how I get people back to work. And those that were exposed with non-symptoms, how they did come to work, and we put boots on the ground with precautions. Just for the public, because we have this memorandum in front of us from DPH, and it is on the Mass Department of Public Health's website. Do we have a second on David's? Tony seconded it? Any discussion on this piece of paper in the
Can you
process?
repeat the motion, please?
The motion is to follow the Department of Public Health
Yes.
healthcare personnel and potential exposure on patient COVID-19 guidance issued on March 19, 2020.
Okay. Nicole's comment is, does your motion mean just the people critical to healthcare or any employee, and they have to follow the guidance?
So this addresses healthcare personnel.
The document addresses healthcare personnel, but we can apply whatever we want to whoever we want.
I am only making a motion for healthcare personnel.
So,
Well, I'm not going to amend this document here. If we want to make another motion, but I think let's make a motion to deal with healthcare personnel, and then if we want to do something else,
Extend it further.
let's do it at
Okay.
another motion.
Dave-
Not try to combine the two.
Dave is stating that his motion is applicable to healthcare personnel, basically our EMS staff, as far as the government structure is concerned, and maybe our public health nursing, those are the only medical people. And that if we want to address the layman, basically my staff, me, then we would do that in another motion. Right, and his motion is to follow the guidelines of the healthcare personnel with potential exposure to patients. Again, it's just guidelines, so we just want to solidify it as a policy. We got no discussion on it so far.
No.
Could I put,
Roland is
if I
weighing
may,
in.
could I put something out on the table because of the way Andy explained this to Nicole. I understand what you're doing, David, for healthcare workers. I would entertain consideration. I don't care how you term it, whether it's first responders or our employees working in the field.
I consider them all healthcare.
So, to make it clear, our healthcare workers is considered by this board for the town of Southbridge to be any of our workers in the field. That would be considered DPW, police, fire, EMS, correct?
No.
You hearing him?
I would maintain that it would cover fire, ambulance, first responders, healthcare, nursing. and
So,
all
yeah.
that.
Ambulance,
But
healthcare,
it would
nursing,
not cover
first
DP
responders.
workers or all that.
And-
I just think we need, if we want, we should do it.
We see, right, and that's what he's saying.
And
We
police
can-
police are
Separate from
close
the-
proximity
from the
considered
regular work.
first responders.
Another motion could entertain that.
if you consider them health,
Okay.
but what I think Dave is saying though, if we wanted to extend it, then we'll have another motion on the table. But he just wants to get through this particular motion as it sits now.
Healthcare workers from regular workers.
So this is
This motion is just
to
for
address
healthcare
healthcare workers.
EMS, first
We
responders,
have one motion that we
nursing.
dealt with travel.
school nursing.
Okay.
Yep.
We've had, now this motion, we're dealing with healthcare providers. Granted, it doesn't state in the document who is considered a healthcare provider, but it does state in other documents what that addresses. And whatever that, whoever that covers is considered, I would consider whatever DPH considers a healthcare worker as being under that guidance for right now. And I think to amend the motion to then to have this cover the document that as stated to cover something that it wasn't designed to cover, I think is a mistake. I think we stick with it, and then we make another motion to deal with anybody else.
Right. The DPW.
So,
DPW.
to be clear, you say you are referring to the definition by DPH on who they consider healthcare workers.
Yeah.
Do you want to keep this, the continuity? Do you want to add those names into this so that everybody is clear on what your intentions are on what DPH considers healthcare workers?
I would maintain that I would amend it to cover anyone that DPH deems a healthcare worker. So, but without having those actual people in front of me. So I'm not sure. So I'm looking at it right now. We can nursing, pharmacy, dentist, physical assistants, counseling. What else are we looking at? Ambulatory, adult health. So I think it gets a little.
Rather than take the risk of leaving somebody out, Dave is suggesting that we
I don't
keep
know
it
whether
vague
we
enough
want to
to
get into
be
all the names
inclusive.
right now, but I think we just follow the guidelines.
Yep.
Dealing with all our healthcare workers that we have.
Yep, so the motion on the
Can
table
we
is
allow
for healthcare
DPW
workers
at their
only
discretion to determine who these
to
people
follow
are?
the guidance of the
Well, there's
DPH document.
guidelines already.
All
I
right.
just don't have it in front of me.
Okay.
I mean, who those people are.
Okay.
So we just have to, the direction,
They
the
could,
the
but they would
motion
have
would
to
address anybody
report
under
their
that.
temperature.
Okay,
wear a
under
mask
that
all day,
criteria.
Right.
If they get a conclusive
So
exposure.
you had seconded it, right, Tony?
Yes.
Any other discussion?
Any other discussion, Nicole? Nope, we're good.
All those in favor of Mr. Williams' motion?
Those in favor? Nicole, vote. Who voted? All three members? All three members voted. What's your vote? Vote in support or not? Nicole? Nicole's in support.
Okay.
Okay, so it's unanimous of all votes present. Okay, is there anything else?
No other motion.
On that, okay, next agenda item.
Anything else on agenda number 5? General discussion
General discussion, Mr.
pertaining to
Jovan.
COVID-19.
Mr. Jovan has proposed that we put an agenda item on the agenda under emergency agenda item. Because this thing is so fluid, and at any time the council may have to vote a municipal state of emergency, he asked that this board, under an emergency agenda item, because it has to be any action of this board has to be in concurrence with them, or may have to be, that we at least discuss and consider a motion for to declare a public health emergency of the town of Southbridge.
Okay, I'll entertain a motion to add an agenda item.
I'll second.
Motion
All
to
those in
add
favor
an
of adding
agenda
the agenda item?
item. Vote to
Yes
add
or
the
no,
agenda
Nicole?
item. Yes. Yes.
Okay, so the agenda item is added. Andy, please bring if you can restate the agenda now that the agenda item now that we have one.
The
We'll
agenda-
consider this agenda number 5A.
The agenda item will be to discuss, consider, and vote whether the board wants to declare a public health emergency due to the COVID-19.
discuss, what was right, discuss,
Declaring a health emergency.
That's the motion right now.
declare.
With regard to the COVID-19.
Is the,
I d-
is the motion
not. I
to
should be okay.
discuss or is the motion to declare? Oh, motion to discuss
We're
and consider,
We're discussing that now, we're adding that to
and
this agenda.
consider,
And then vote.
declaring a public health
Uh,
emergency.
All right, I will update you.
We have to have the discussion.
I know you have to leave at work.
Declarations.
Right, but
I
I
will
know what
update
the
you.
ultimate goal is to discuss or to actually declare.
Okay,
Okay.
okay. I don't know if I can put your vote in if you're going to be absent at the
So-
time of voting, but,
That is the
yep.
agenda
that-
5A.
Okay, done.
Vote to discuss and
I'll update
declare.
you. Bye.
Vote to discuss and consider declaration of a health emergency for COVID-19 outbreak. Do I have a motion to open up the discussion?
I'll make the motion, but I have concerns about discussing, I mean, I have no concerns about discussing, but I would have concerns about possibly considering declaring without information in front of me. But, so I'll make a motion to open 5A. But I'll make that motion.
Do I have a second on opening it?
I'll second.
Tony seconded, okay. Discussion. Andy, if you could, if you have it, give the statement on why we have to discuss declaring it.
The council, I've spoken to individual members of the council, and they seem to be of the opinion that if the town declares a state of emergency for the town, that there is a increased opportunity to receive back funds that may slip through the cracks through the state emergency. It's kind of like double coverage. We should get the protection because of the state of emergency at the state, but they want to ensure that at the local level we can apply for whatever funds we can. A state of emergency would allow us to do that. From the Board of Health point of view, it would be up to this board to determine. We are currently have 3 confirmed cases in the town. We have 2 suspect cases in the town, and I believe, and I'm not confident in this number, but I believe the hospital has upwards of 15 people that are under investigation. So based on those conditions, based on the spread of the disease, based on the actions of the state and feds, this board has the right to act upon that motion and declare it or not act upon that motion. Ms. Nicole has expressed that she is in support of this. She is very in support of this. Unfortunately, she had to sign off.
Okay. To expand on what Andy said,
So if the minutes can show that she left at 1 o'clock.
okay. As a caveat to that, because of this situation and it's a health situation, it is requested that the board show their support if the council does act on calling a local state of emergency. As Andy said, it may or may not give opportunity for things. Since the governor did this, it absolves us from a lot of requirements or red tape. If there's any that the state doesn't do or doesn't allow us to do, this allows us a lot of leeway on what we can do. The action being taken by this board is either we support the council if they should choose to call a state of emergency, that they either have our support as a Board of Health or not because of this health situation.
If I can, Roland.
Yes.
Understand the motion on the table is to declare the Board of Health state of emergency. That, if this is voted as a Board of Health state of emergency, it goes on as a Board of Health state of emergency, whether council votes on it. So it's not in support of their action. It is a separate action that may give strength to their action if they choose to move that way.
So you're looking for us right now to vote on whether or not we'll
Right now, we're in
declare a state of emergency?
We're in any discussion pertaining to us declaring the Board of Health a state of town emergency.
And so that, what that allows is then if the council then says that there is a state of emergency, that opens up more avenues for assistance?
There's a potential.
Potential.
It's
Potential.
basically that the state of emergency at the state should open up the avenues for recouping costs for, we're just trying to put every net out there should the council decide to make this action. But the reality is, separate from the council, this board has to decide if this COVID-19 elevates the town of Southbridge to a state of emergency, to a public health state of emergency, regardless of the council's
The
activity.
council, okay.
This is separate. It would help to support the council, but that's not this board's consideration. This board's consideration is
Whether or not it
are
is.
we in a status that should be considered a public health emergency?
Okay.
Anything else, David?
No.
Yeah, I'm not, like I opened up, I'm perfectly willing to discuss, and I'm perfectly willing to reconvene, tomorrow or any time, but I'm not inclined to, for two reasons. I'm not inclined to declare a public health emergency without any documentation, without anything in front of me, without, really thinking about this, or certainly not declaring it because it opens up funding opportunities. I mean, there needs to be a public health reason for that. So, adding it to the agenda and having us vote on something that critical, I'm not going to vote for right now.
Okay. Nicole's off. Anything from?
Nicole is off. Nicole did express support of this. I don't think, because she didn't sit through the discussion, that she can take part in the vote, but she is in support of the motion.
Which is good, because that would have made 4, and that could be 2 too. So
The other issue is on my, you guys all set?
I'm set, thank you.
Tony, you good? Okay. My opinion on, and this is why we put our heads together and we work well, to what you said, David, I am concerned myself because this community is unique. We not only have a nursing home, we have visitors into our hospital. We have tangible evidence from the hospital that we had 11 to 15 suspected cases. Correct me if I'm wrong, they are told to be self-quarantined. Or they're suspected, so...
Some of them are held at the hospital. Some of them
Correct.
are, the 2 cases that are suspect for Southbridge right now are self-quarantined at home.
Okay. We have these added risks, in my opinion. Declaring this, I don't think hurts us. I think it can only help us, not only for money, not only for payback, but as all for leverage to do what we need to do for the health and safety of anybody who comes into this community. I was concerned when I heard how many presumptive reports. I'll leave it at that.
Let me ask you this. I understand what Roland's saying. And I understand you don't want to have a knee-jerk reaction. What is the harm? Like, what are we prohibiting if we do declare a state of emergency?
And think about it. The governor already did it, so did the president. We are now just bringing this down to the local level, that the local boards and the local people operating this community as a locality are also making it on our own and putting our name on the document. That's, I mean, it's there. It's just if there's any loopholes between state and federal, we have followed suit.
So as Andy's saying, we're just trying to cast nets as far as we can. Are there any restrictions as far as the citizens go? Should we declare?
This was handed to me right before the meeting. I was asked to put it on as an emergency agenda item. I haven't had time to research it yet. Roland has been an EMD and is aware of emergency situations. I believe it just opens us up to opportunity. It does not prevent us from anything. I believe it's just an opportunity.
Is that how you understand it too, Roland?
And if anything, any other, like I agree with David 110%, we are going to be gathering information by the hour. If there's anything that comes up that this board has to make a decision on doing A, B, and C, we would have to convene, but if there's, and make that decision as a board. This is not a free-for-all. That being said, this gives us the weight that this board, regardless of whatever the governor or president wants, this board's job is declaring an emergency for our community for health, and therefore we are tasked to make sure that we do the best decision-making for the health of our community.
Certainly understand that. To your knowledge, there are no restrictions. This is purely just to allow us more opportunities to.
There's two things that I had experience with. When we do a snow emergency and the governor declares a snow emergency in Worcester County, they did it for us, okay? When we had the tornado, there was no county statewide declaration. Therefore, the town of Southbridge did it as a community because there wasn't enough widespread. This only covers us for a variation of the open meeting law, the red tape. If there's supplies and things that we need, we're pretty sure that we don't have to go out to bid because of the state and federal declaration. But this will cover if we have to go out and purchase protective equipment and so on and so forth. This absolves us from the bidding laws because we declared an emergency. If there is a loophole in the state or federal that says you have to go through them first, we're declaring it for us on our own. Okay. I have never seen any downside. This is not a dictatorship. It doesn't meant for that. There is already a state and federal. This is taking it to our level to make sure that
we make ourselves available to everything
we're
possibly
covered.
can.
State and federal cannot put any restrictions on us. We're covered.
Okay.
To do the best for our citizens.
Okay.
That's the way I've always had experience with it. Anything that you've heard different?
Nope. I can only imagine. I can't think of any detriment that the declaration causes. It just opens us up to opportunity.
Action.
Okay.
And even if the council votes no tonight, this still gives us some action that we can do whether the council agrees to it with us or not, because it's in effect for the health.
Okay.
Or the direction of health. Anything else?
I am good.
No other discussion?
No other discussion.
So that's a discussion. If I'm not mistaken, Madam Secretary, I will entertain a motion to declare a health emergency in the town of Southbridge with regard to the COVID-19 virus.
So, given all the information that I hear, and I truly believe this is...
Discussing or making a motion?
I'm making a motion.
Okay, so before you discuss...
all right, so, yes.
Before you discuss, we have to have a second parliamentary procedures to have a discussion. So we have a motion to declare a public health emergency for the town of Southbridge with relation to the COVID-19. Do I have a second?
I will second.
You are the
voted
first.
it.
You made the motion.
Oh.
So do we have a second for discussion?
You'll have to make the second because I'm not seconding it because, as I stated, I'm not in favor of this right now.
Okay, so for the point of discussion, I will make a second.
We already discussed it. This is the point. Oh, you mean the discussion for the...
For the vote.
Okay.
Yes, that's what this is. We're on the vote. Andy, you had discussion on the vote?
No further discussion.
Okay. Anything else for discussion?
No.
No further.
Okay. So, to declare a public health emergency, all those in favor? Opposed? Two in favor, one opposed. Okay. Is there anything else, on Agenda 5, with regard to discussion, general discussion on the COVID-19?
I present nothing.
Nothing.
I put it on there so that the board can bring forth their concerns,
Okay.
and we can discuss them.
I have an Agenda 6, which is the next scheduled meeting.
We already,
I have a question. We had a meeting scheduled when we met Saturday for school closing for 2 weeks. And I believe that was, if I'm not mistaken, the 26th.
6.
The governor amended that to close all schools for 3 weeks. Do we want to change that meeting date? Would it be prudent to change that meeting date to get closer to that 3 weeks so we can take all the information that we have and make a decision for our community whether we extend it, regardless of what state does, or we have the provisions for getting the kids back in school? That's just my thought. I have no problem if we continue with the 26th, but I just wanted to entertain and refresh the memory.
you're saying push it
We already
back?
have
Right,
pushed
we
it
already
further
did on the
forward.
26th.
I think we should meet only because,
On the 26th?
yeah. it
Okay,
just-
so the next
Yeah,
scheduled
it's already
meeting
there.
is already set, 6:30 PM on the 26th of March.
It's not like we're going to have lack of things to discuss.
Well, that's it. It doesn't hurt.
At that meeting,
Okay.
the board may want to consider setting a brief meeting every Thursday
That's the point.
for, just to stay on top of this thing.
Okay.
That's a good idea.
So every Thursday we'll meet?
Do we
I
want to
think
make that now? or
I
we
would
wanna-
suggest that you hold that.
Let's discuss
thought
that on the
For the
26th.
26th, because it's not an agenda item per se, but
right.
also because hopefully there'll be a whole board here, and the whole board should weigh in on that.
The next meeting's already scheduled, so we
26th.
just concurred with that previously scheduled meeting on the 26th.
I'm in agreement.
Okay. Any other business? All right, I'll entertain a motion to adjourn.
I'll make a motion to adjourn.
Second.
Okay, all those in favor? We are adjourned at 1:16. Thank you.